13th of June is a blood donation day, and today to discuss the assessing of the dynamics of blood donation in India, we have three prestigious members from the industry. We have with us Dr. Sangeeta Pahuja Sindhwani, who is currently the professor and head of Department of Hematology from Lady Harding Medical College. We have Dr. Vanshri Singh, who's the director of Blood Center of Indian Red Cross Society from the national headquarters. She's a postgraduate in transfusion and transplantation of sciences from Bristol University, UK. We also have with us Ms. Sumati Mishra, who's the head of medical affairs with Datri Blood Stem Cells Donors Registry. Welcome, all three of you, to Business World Healthcare on this special day. My first question is to Dr. Sangeeta. Ma'am, what is the blood need of our country? How many units do we collect and how much is the deficit that is there?
For this very important panel discussion. So, we are a huge country. We have the population of around 138 crores. So it has been estimated that we need around 14.5 million units of blood. So most of this is met, around 90% of the need is met, but we have the deficit of nearly 1 million units. So apart from the numbers, what is more important is availability and excess of the blood units in the remotest parts of the country. So there is usually no shortage in the big cities like Delhi, Bombay, or in the urban areas, but the safety, access, and availability of blood and components in the outreach areas is still a concern for our country.
You actually touched upon a very important issue. You use the word excess. So when we have excess of blood, Dr. Vanshi, I want to ask you, how do we ensure that there is zero blood and blood components wastages?
We have to see what is the demand and what is the availability. Once you come to know demand of your own blood bank, so you can increase the collection or reduce the collection, and as well as you have to also see the component requirement. If you go with the example like during dengue, that the platelets demand is suddenly increased. You have to make the platelet on the right time, and the collection should be accordingly. We can also link many of the hospital near to your center and also link the storage center. So the outflow of the blood from your center to another usage area can be increased. And there is also a facility which we have started is through the app. People want blood, but they don't know whether they will get the blood or not. So through our app, the blood is blocked and the request come to us. In that case, our outflow is very high and request to us in advance. So we know what is the requirement in next 7 days. So this type of system can start in the different blood banks.
Since Dr. Vanshri used the word platelets, and I know there is some difference between when we look at blood donation in a typical sense as a layman, as we understand it, how is it different from a stem cell donation?
Mr. Nirula, thank you so much for asking Datri to be part of this. Every person made aware is a person whom we get onto our vision and mission. So platelets is part of blood. Okay, it is one of the components that make up the blood. Blood stem cells are slightly different. So stem cells basically are cells that are made in the thicker bones of the body. So the pelvic girdle and the thigh bone, the backbone, is where the stem cells are made. Okay, they're also called mother cells because they can become different cells as they mature. Okay, now it's also called bone marrow, which is something we've all heard about. So when you extract bone marrow from the bone, the product is called bone marrow. When you take this cell which has overflown into your blood, it is called blood stem cells. It's the same cell, but from a different source in your body. So when you do a bone marrow collection, you have to be admitted to a hospital. You will have to undergo anesthesia, which is what scares a lot of donors. Okay. When you do it through the blood, it is an outpatient procedure similar to a platelet donation. It will take about 3 to 4 hours, but you are awake the whole time. And you can help a patient in need.
Thank you for explaining this. But do you think that the government has taken up enough measures to safeguard the interests of the facilitators involved in the process?
So there is no specific law that talks about blood stem cell donation or a bone marrow donation. Mm-hmm. There are laws that talk about apheresis or how blood banks are to be run. Mm-hmm. So we are partially covered there because every stem cell donation will happen through a blood bank. Okay, but there is no law specific to a stem cell donation, right?
Dr. Sangeeta, I mean, this brings me to the next question, that when we speaking of law, blood centers are regulated and licensed by DGCI, right? Why is there a need for accreditation? I mean, a lot of people have asked us this question that, why do we need to do it? When there's a deficit of blood that is required, why license it?
See, licensing is the mandatory requirement, and that is done by the Drug Controller General of India. Without license, you cannot run the blood center in India. And then there is another thing which is called as a blood storage centers, wherein the DCGI gives the approval. So license is a basic minimum which is required. So the drug inspectors look at your infrastructure, your personnel, even your quality parameters, but accreditation goes much beyond that. So accreditation is an assessment by an independent third party. Now remember that accreditation is a voluntary. I'll say, okay, I want my blood bank to be accredited. I am inviting a third party to come and assess my blood bank, whether we are doing all the parameters, all the processes and everything is as per the predefined standards or not. So that gives me a confidence much beyond the licensing level that we have the quality systems in place, and this enhances the blood centers to go in for further continual quality improvement. So once a blood bank is accredited, you know that you are continuously moving up. It is a regular, ongoing, continuous assessment and continuous quality improvement. So that is the benefit of accreditation over and above licensing. Even as customers, even as your patients or donors are coming in, once they know that your center is accredited, they have more confidence that you are adhering to the quality standards of care.
Dr. Vanshri, what are the key challenges faced in blood donation procedures? I know we have come a long way. It has become much safer. It's become, the environments are clean, hygienic and everything. But what are the challenges that we are still facing that need to be addressed?
You can start the procedure from inviting the donor. So it is very difficult to target them, when to call them, because they come by their own. So we are not having a repeat donors a lot, which is a challenge in the blood donation procedure. Every time you have to start the counseling, everything in the same way as a first-time donor. And secondly, because donor doesn't have a lot of time to give all the queries or the deferral procedure detail. Always in the camp, I see they are in hurry, just filling the form, and you even don't have the type of infrastructure in the campsite where the confidentiality can be maintained, and the detailed examination of the donor by questioning the detailed procedure can be obtained by the donor. So this is one of the challenge. Second is because donor doesn't want that he or she is made unfit when you come to donate. Why you are making us unfit? I am having 12.3 hemoglobin, 12.5 and 3 is what is the difference? They start arguing with us. So this is also a concern when we say no to a voluntary donor. They feel bad about it, and because they are coming to donate voluntary, and they should understand if your blood hemoglobin is not good, it is not going to give advantage to the patient. So best is to disclose your history nicely, and because it is going to benefit the patient through your voluntary effort. So we always say this to the donor. And secondly, the main myth also is coming with the during the donation procedure, that still the prick is there. This bag is very painful. I want to swim or I want to drive after this procedure, whether I can or not. So all these things are there. And also the donation procedure during this type of summer, summer, extreme winter, is making a problem for us in the campsite. And you cannot even park the vehicle outside, and in the mobile van the person is stepping in the hot weather. It is difficult to donate blood. All these things, I can say this is mainly with our North India condition.
Dr. Vanshri, since you brought up this, that, a lot of people come in and say that, I am fit to give blood, why aren't you taking it? Can you lay down as to who is a person who's fit to donate blood?
Age criteria 18 to 60 was there. Now it is 65. If the person has donated more than one time, you can take up to 65. Other condition is for the blood pressure. There are some parameters which are in the acceptable range, and the pulse and other is if the hemoglobin is 12.5 and above, and there is a maximum limit also, because beyond that hemoglobin, increased hemoglobin, you cannot take also 17.5. And many of the permanent deferral conditions, like if the person is having any heart problem, kidney problem, liver problem in a wider range, any kind of bleeding disorders, or gone any kind of major surgeries, there is a deferral for that. And for the surgery, you keep the deferral for 1 year. And if you have taken a transfusion recently, there is a deferral. And also certain antibiotics, there is a time period of deferral. There is a vaccinations, there is a deferral. Diabetes, oral hypoglycemic drugs you are taking with no complication or side effect of diabetes, you can donate blood. But if you are on insulin dependent, you cannot take blood from that donor. And also typhoid, there is a period of deferral. And thyroid history, you cannot donate blood. All these parameters is defined by the drug controller, and this guideline is issued and updated time to time. And all the blood banks has to follow these guidelines strictly and ask the donor to fill the form. And also you can ask the different question from the donor. The donor has slept in the night properly or not, any long traveling history. All these things you have to ask. And for the women also, there are different parameters. During the periods and during the heavy bleeding, you cannot donate. During pregnancy, lactation, you cannot donate blood.
Got it. Sumiti ji, like for general blood donation, there are these do's and don'ts, and who can give blood or who's not supposed to be giving blood. What are the parameters any different when it comes to stem cells?
Donation, very similar. The age is between 18 to 60. As Dr. Vanshri said, we haven't gone to 65 yet. We are still at 60. We register people up to the age of 50 because we don't know when you will be a match. Okay, it's like playing Russian roulette or teen patti. Okay, you don't know when you get the winning hand, but you need to be healthy. Before you donate, there will be a medical checkup that we will get done, a thorough medical checkup. So we don't want the donor to suffer any consequences or the patient to get another, disease just because there was something in the blood and it got transmitted while the transfusion is happening. As far as deferment is concerned, like Dr. Vanshri said, dengue, typhoid, COVID, all have deferment. So you can donate once you're fine, but the deferment period is generally between 1 to 3 months. Okay. People who can't donate, insulin dependent diabetes is a straight no. Okay. If you have a history of epilepsy, we will not put you through to it. Okay. If you have a heart condition or something else, we will get a clearance from that particular doctor as well. So that's an additional clearance that we will look for, but it is not a reason for making you ineligible. So anybody in the age of 18 to 50 can donate as long as you're healthy and you clear the medical exam.
Got it. Dr. Sangeeta, I know that, I remember that once I had gone to donate blood. This is many, many years ago. But this guy next to me, he got into some situation called syncope where he kind of started sweating and they had to put his legs up and other things. What are the post-donation or during donation adverse reactions that people usually get, and that's something that you have seen? And what are these, and how can these be prevented? Or what is it that people should know that this is all right?
Yes.
It happens, but it's nothing great.
Some people after donation or during donation can get reactions. So these are the untoward events which sometimes happen. Mostly they are not severe, they are not very significant. The most commonly what happens is the hematoma, which we, in simple terms, we say the bruise. That is the blackening at the site of the needle puncture. Right. So that resolves on its own in 2 or 3 days. It changes color, which sometimes look bad to the donor, but it is very very, very benign thing. It is not very significant. Now, what you were referring to is called as a vasovagal reaction, or syncope is the vasovagal reaction in which the patient loses consciousness also. So vasovagal reaction has both the aspects. One is physiological aspect, that he is losing some blood volume, and the other is psychological aspect. Now, psychological aspect is a very important aspect in vasovagal reactions. Now, you must have heard that some people, as soon as the needle pricked them, they felt faint or dizzy. So at the sight of blood also people faint. So there is lots of anxiety and fear which is associated with this reaction. So it's been seen that the young donors or the first time donors, even very healthy looking young boys who are in the age of 20 to 25 years, they get lots of these vasovagal reactions when they come for the blood donation for the first time. So this is because of the anxiety and fear that leads to the activation of our parasympathetic system, and it leads to decrease in heart rate, and the person will feel dizzy, some sweating, and he may feel like I'm going to faint. So for these kind of reactions, one thing is talk to donor, give him adequate information about what is going to happen. Some of them are so afraid कि पता नहीं क्या हो जाएगा. So talking to the donor and comfortable environment of the blood center or of the voluntary blood donation camp, then the reaction or the response of the staff, how friendly they are and how comforted or safe the donor is feeling in those surroundings is very important. Now, coming to the physiological aspect, we never take blood donation more than what is recommended for the body weight of that person. So if the person is 45 kgs, we will not take more than 350 ml of the blood volume. So we have the blood donation as per the weight of the person. Then the second thing is, if the person has rested well and eaten well before donation, mostly these reactions don't occur. If the person is hungry, he's not slept well, and it's been seen that drinking enough water half an hour before donation decreases these vasovagal reactions to a significant extent. So these are the small measures which happen. But if the patient gets these reactions, simple leg raising, loosening of the clothes, and adequate, and we always keep monitoring the vitals, that the pulse and respiratory rate and heart rate is okay. And there is always the doctor who's always available on spot whenever blood donation is happening, for if the vasovagal reaction becomes severe. So very few people can get some severe reactions, but most of these reactions are very mild. And we also give them the post-donation instructions, which if they go out of the campsite and again they are feeling faint or dizzy, then what should they do? So in those post-donation also we tell them what should they look out for. They should drink adequate water and they should hydrate themselves well in next 24 hours. They should not do any heavy activities. If they're walking or going anywhere and they're feeling even sweating on the forehead, the person should sit anywhere which is appropriate, even on the sidewalk of the road, and put his head down between his legs. That will be enough to resolve his fainting spell or the vasovagal reaction. So these kind of instructions are given to the donor, and he's always given the contact numbers of the blood center, that if something happens, and he should contact us immediately.
Sumati ji, what are the potential risks that are associated with stem cells donation? Are there any?
So blood donation has got risk, like Dr. Sangeeta just said. for a donor, even the fact that hematoma has happened is a risk, right? You're putting a needle into the body, so there is a risk factor there. Having said that, this is a very well documented process. It's been there. It's not a new technology. It's been there for quite some time. It has been documented by a lot of studies. It is a very safe procedure. Okay. Like we said, it's similar to platelet donation. The difference is that here you need to have an HLA match as opposed to just, anybody can donate platelet because it doesn't have a group associated with it. Blood donation has a blood group associated with it. Platelet donation doesn't have anything. Blood stem cells has got HLA associated with it. So it's a very well documented, safe procedure. It is an outpatient procedure. And we've not had even one instance in the last 11 years of Datri where I can say that blood stem cells caused an adverse reaction. Internationally, registries have been there for more than 30 years. But it's a medical procedure, so I will not say that there is no risk.
Dr. Vanshi, I mean, Indian Red Cross has been associated with getting blood donations and making blood available for a very, very long time. It's the first name that probably comes to your mind when we're thinking of blood donation. Now, you spoke about that in metropolitan cities, we have enough donors, but in tier 2, tier 3, there's a challenge. What is it that we are doing to educate the people so that there are enough and many people who are available to volunteer to donate blood?
This is a very important question for all our blood bankers. So how to catch the donor or how to engage the donor for the blood donation? Red Cross is doing online blood donation pledging. So there is an app and our online in the website also, they can just engage themselves, or they can put the date also for the blood donation. So we are publicizing at a large so that they can get immediate report whether their camp or their donation is fixed on the particular date or not. Our control room is there 24/7, started during the pit, and it is functioning very well. So they are engaging, they are calling the donors, because see, this is a voluntary act, and they are having their other responsibility for which they are engaged. So you have to request them, you have to counsel them to come forward to donate blood, and the convenient date time you have to give to them. So in my app also there is regular details going on for the public domain, so that they can know at their area where the camps is there. So they don't have to come all the way to this center. After COVID, we have seen the public don't want to go to hospital or to any of the health facility where the people are coming off and on. And this type of move, when we have gone to the villages, in the village of Haryana and near state, what we have seen, the people easily gathered and donated blood at a large during COVID time, when there are a lot of problems, myths, and everything was there, and people were scared coming to us. When we have gone to their doorstep, asked them to donate, lot of people donated blood and fulfill our demand that time. So now we have made a routine procedure that we have to go to the villages and to counsel them, and repeatedly we are getting calls from them to send the vans. Secondly is the trained manpower. Once you have a good environment to your donors, you counsel them properly, understand their time and value, and give them reply of their queries. They donate blood. If your staff is not having a good interaction and they are facing a problem here and there, cleanliness is not there, unhygienic condition, couches is not clean, they will not come back. And they will say this is a first time, very bad experience, and they go back. And we have kept our complaint and rehearsal box also, because our blood bank is accredited by NABH, NABL. So we have to follow that procedure. You have to sort out their complaint, why they are complaining, and if the doctor was not there. All these things happen in all the blood bank, but you have to respond back to your donor. Secondly, whenever the requirement of their family, for their neighbors, or whatever it is coming from the donor or from the organization who has given the camp, you have to respond to them. Anywhere in the country, we request them, our stakeholders or the Red Cross who are having the blood banks, connect to this donor organization to help them, because you are getting blood for the community, by the community, and you have to move. You are only a linkage between the two communities. So this way we are forwarding ourselves.
My next question stems from the answer that you were giving, and that question I'm going to go to everyone to ask, but I'll start with you, Dr. Vanshri, that how has our country developed in terms of the infrastructure for storing the blood and the blood components? So let me begin with you, because right now we have three people from three different kind of institutions. One is into blood donations and storing, the other one works in an hospital which requires a lot of blood every time, and third one is into a different process for getting the stem cells. So each one of you, I want to get your views as to what is it that you are doing to ensure quality storage.
Storing is an area which is also having the guidelines for drug controllers. So all the blood bank who are having the license has to have a control storage system. The problem is, which I am seeing, that whenever we get the request from the hospital, the patient is coming along with the box. So where is the storage? Storage during transportation from one blood bank to another. So always my request is with the blood banks, send your ambulance with the storage, proper storage containers, and with your people. Don't send the patient attendant like this with the box, because they don't know the transport condition. They go here and there and do the shopping or go to the home, then they go to the hospital. How you can catch hold? What is the time period when we have issued, when you have received? What was the temperature? So all these things you have to also see. Even in the Delhi maximum hospital, they send the request like this, only the refer. So drug controller has started the storage centers for the hospital who requires blood, and the mother blood bank can become a supplier for that center. So we are having the 8 to 10 storage center in Delhi, where we are giving blood to them to store, and they do the cross match and issue the blood directly. As we don't require the replacement, so we don't have that type of problem that after replacement only we issue the blood. So this challenge has to be taken care by the blood banks only.
Dr. Sangeeta, what is your take on this?
So, as Dr. Vanshri has already mentioned, the cold chain maintenance is one of the very, very important and significant steps in keeping blood in components. So, Dr. Vanshri said that she's associated with many storage centers to which they are giving them blood regularly. So, even within the blood center, we need to keep our equipment very well maintained, and as per the DCGI guidelines, we need to calibrate all the equipment. Like platelets are stored at room temperature 22 to 24 degrees centigrade. So but there is a regulated platelet storage and agitator equipment in which that temperature is maintained and they are under continuous agitation. So, and the plasma is stored at -20 to -80. We have different kinds of deep freezers in which we are keeping our fresh frozen plasma. Whereas Red says we are storing at 2 to 8 degrees centigrade. And we are supposed to be calibrating all our storage equipment biannually at least, so that we know that the reflected temperature is the actual temperature. So at no point of time, even during transport, like we and Dr. Vanshri keep on exchanging blood in terms of deficit or excess, we keep on doing that. So whenever we are transporting blood, we need to know that the blood at no point of time has exceeded 10 degrees centigrade temperature, because otherwise it will be wasted and we cannot transfuse it to any patient. So even when we are sending the blood or any component from our blood center to the ward or to emergency department, the instructions on how long the blood can be kept, like red cells have to be transfused within 30 minutes. If the red cells are kept beyond 30 minutes, then it is wasted. We cannot use it for the patient. And the platelets in the plasma, they have to be transfused immediately to the patient. Now, there are newer things which are called the tags, which are put on the blood bags, and they give the indication if the blood bags have gone out of the temperature range. So with the help of the innovative technologies, we are moving further. But cold chain maintenance, no doubt, is very, very important backbone of any blood center.
Sumati, let me come to you, because I've understood Dr. Sangeeta did mention that, there is a room temperature that you have to maintain the platelets at, and there's a different temperature. What are the challenges of distribution that you are facing? Because, usually blood is available easier than the platelets being available or stem cells being available. That's my understanding. So, and usually this could be required because the place for collection and storage could be very different from the actual usage of that platelets. So how do you take care of transportation? What does Datri do?
Here, the difference, the primary difference is we only collect when you're a match for a patient. We do not collect any stem cells and keep it, in a bank or a blood bank or anything like that. So, when a donor is a match, that is when we have a patient in need. So when the donor HLA matches the patient HLA is when Datri will talk about a collection. Okay. Secondly, the collection will happen, like I mentioned, in a blood bank. So we are associated with hospitals across the country where the medical checkup of the donor is done, there is counseling of the donor, and then there is the collection. Okay, so everything that Dr. Sangeeta said, that they have to keep their blood bank up to the requirements. They are our clients in this case. So I would go to somebody like Dr. Sangeeta and say, I have a donor who needs to donate. Let's work together. So Datri doesn't own any blood banks, does not own any apheresis machines. We partner with hospitals who are doing this for us. Okay, so when they collect the sample, the product, they will hand over the product to us. There is a report that is generated which determines the viability of the stem cells in the sample collected, and we will transport the product to wherever the patient is being treated. So we deliver the product in a cold box where the temperature is between 2 to 8 degrees. Post the collection, we will look at the temperature logger as well to ensure that it was maintained, the temperature was maintained. In India, we deliver the product within 24 hours of collection. Internationally, our timeline is 48 hours. Anything beyond 48 hours, if the product has not reached the treating hospital, there is something wrong in the process.
So,
and once the product is delivered to the transplant center where the patient is being treated, then the blood bank of that center will be responsible for putting it into cold storage or cryopreservation or something like that. Datri is not involved.
Do you see illegal blood donation actions happening? And do you think that the putting SOPs in place is reducing the illegal blood donation? Let me begin by asking you, what is considered as illegal blood donation?
So if I answer that, Mr. Nirula, there is no illegal blood stem cell donation, because unless you have a patient match, there is no step forward.
Right.
Okay. As far as Datri is concerned, we've had SOPs in as part of our protocols, because I'm a non-medico, but I'm working with doctors and I know doctors follow certain procedures and protocols. So Datri follows the same. So we've had our SOPs, and it definitely makes life easier because it helps you understand what is acceptable, what is not.
Dr. Vanshi, let me ask you this question: that what is illegal blood donation? I've heard this term, but I want you to explain what is illegal blood donation.
The donation taken by a not a licensed blood bank. That is the one thing. Secondly, if the donor not giving all the details, like they hide their ID and everything in the consent, and also they are not giving the proper history. So Many times they are called as a professional donor or the forced donor. The family has catchhold the donor and they are asked to donate blood in the place of the unit which a patient has taken. So they are not an illegal donor, they are the forced donor. So illegality, I cannot say for the donation.
Dr. Sangeeta, I want to ask you, are there any social taboos related to blood donation? And I'm not even just restricting it to the metropolitan cities, but when we look at tier 2, tier 3 cities, have you come across any of these taboos that are related to blood donation?
Many people think that blood donation will make them weak. So, which is one of the things that is there in the heads of the people. Actually, see, the thing is, the red cells have the lifespan of 120 days. So after 120 days, so every by 1/20th of the red cells are dying in our body every day. So our blood is going to get replaced in 3 months, either which ways. So what happens is, when we are donating blood, actually we are stimulating our body to produce more erythropoietin, so more red cells, fresh and newer red cells are being produced. So that is one thing which people are afraid of, that if we donate blood, then maybe some adverse donor reaction might have led to that kind of a thinking. But that is one of the big things that people don't want. The other thing is, some people have some religious taboos also about receiving blood from some other communities or some other people. So that is also one of the concerns, that people don't want to. But here there are no boundaries of age, sex, religion, community, nothing. So blood center does not write on any of the blood units that this unit belongs to this. No details are shared of any of the donors. So this is about that broadly. But regarding illegal donors that you were talking about earlier, so professional and paid donors actually have been banned by the high courts. Those people who ask for money in return of the blood donation. So there are, when people see that somebody is in dire need of blood, and there is no, when there is a good voluntary blood donation, then it is a good thing. But if, say, a person needs 10 units of blood, the blood center can only give 5 or 6 units on its own. And they're asking, okay, ask your family members to come forward and give blood, which is actually replacement donation, which we should not be doing in ideal circumstances. But in India, we do not have very much replacement donations as per date today. So in such cases, what happens is, some people will come forward, they'll say, okay, give me this much of money and I will donate for you. So they will, as Dr. Vanshri said, they will not reveal the history of drug addiction or promiscuous sexual history or use of the needles, shared needles, or any kind of such, or even if they've had jaundice, or even if they know that they're hepatitis B or HIV positive, they will not reveal that history. So professional or paid donors has been made illegal by law. So that is one donor which we should not get into.
Dr. Vanshri, I want to ask you this. Since Dr. Sangeeta just mentioned that, people are coming and they may not be revealing the reality of their medical history, their backgrounds, like hepatitis B or HIV. And most of these, we've seen that, blood or blood transfusion is the cause of spread of HIV, etc. Right? What is it that you do to ensure the safety of the people involved in the process of blood donation? So, I mean, your staff that is there, what is it that that you as an institution do?
The process, in the process of a staff is involved, they can get the needle pricks during donation, or if there is any cuts or wounds in the hands, even the blood spill can be, which is untested, they can be infected. So we ask them to properly wear the gloves, everything, all the safety parameters they have to follow. Secondly, taking the history also is a good, because in the counseling stage only, if the person has deferred, so you are not crossing through many of the years. where the donation has been taken place, or you are going to test, and the untested blood is processed by the components. Because if even the blood is leaked and it is untested, and it is HIV positive, you can imagine how much big is the risk. Secondly, as per the accreditation rule also, or the guidelines, we all the staff is hepatitis B vaccinated. We do titers regularly, so that anytime if there is a chance of infection, the person is protected. Secondly, it has to be given 2 hours, just 2 hours after needle prick. So every lab is having that type of needle prick kit, even in the camp also, and there is a proper training. They have to take this drug and inform the medical officer. Then they have to go to ART center, where they check the person. We also check within same day or within 24 hours, after 3 months, after 6 months. This is a protocol which you have to follow, and you have to maintain. But precaution is the best way, where you can just protect yourself.
Like you said that you work as a registry, and people register themselves, and it's a need based. When there's a need, that is when the action is taken. Now, if I understand correctly, there was a huge need that came up during the COVID or pandemic. Is that correct?
The need was always there. It became more obvious during COVID, because a lot of surgeries didn't happen. So people who suffer from blood cancer didn't even know where to go for treatment. But stem cells came into limelight because a lot of cancer patients didn't get treated for hospital for medical checkup.
What I want to ask you is that during COVID-19, a lot of medical institutions and they recognized the gaps that existed. A lot of these gaps were exposed, which were otherwise never coming to limelight, because there was never a situation that we have seen in the recent past, other than the pandemic in the last 2-3 years. Now, were there any gaps that you have recognized as an institution, and what have you done to bridge these gaps, keeping in mind that these kind of situations are usually a temporary situation?
So for us, COVID-19, the biggest challenge was getting donors for medical history and clearance from a doctor, because it has to be done at a hospital. Mm-hmm. You can do the blood work, you can send a technician, get the blood and do the sample check at a lab. But to meet a doctor, you need to go to a hospital for imaging studies. So that was where the challenge was. Partially got covered by telemedicine. A lot of hospitals started doing teleconsults. Okay, but one thing that we found was that when you do a blood stem cell donation, like I mentioned, it's about a 3-4 hour procedure, which means your veins need to be good. Your veins need to be able to handle that kind of a procedure where blood is going in and out of your body. So the vein check becomes very important for us. And we've started talking to doctors about getting a local hospital doing a vein check for us, rather than trying to do it on a teleconsult. Mm-hmm. So if I have a donor who will donate in Delhi, but comes from a tier 2 city, unwilling to go to Delhi during COVID, then we will ask the Delhi doctor saying, can you tell us who he should consult in this region? So that the person goes to a local doctor and shows the veins. No point in getting them for a donation and then realizing there's a problem.
Got it.
So, but we did realize that getting people into the hospital was difficult. And because of that, Datri also created we call it the donor safety package, where we know everybody wears masks, everybody uses sanitizers, but we give a gift to the donor saying, this is for you for stepping out of your house.
Right.
So it's just a way of, psychologically telling them we care for your safety.
Got it. It's a very beautiful thing to do.
We are looking at a patient in need, and that donor could be the only hope.
Got it. Dr. Vanshi, that with the increase of new mutants that we've seen in COVID-19, Do you think people are getting more aware about blood donation process? Have you seen that change in the psychology of the donors 3 years ago versus today?
Yes, because still they have that mindset, or they are taking the precaution as it is. Like mask was already there, but they want a clean area. They are using sanitizers. They are not having a very close, going closely with the doctor even. So this type of things are there, and even during taking the refreshment, they don't want to take the refreshment which is open. They always keep the closed one. So this type of things are there. But slowly, this you can say their mindset is like they are becoming relaxed. They are forgetting the COVID now and coming back to the normal situation. Yeah.
Sumati, I'm going to come back to you now once again for this question. That what do you think that the government should do to increase the blood stem cells donations? Is there something that you feel that the policy makers need to do?
So like I mentioned when we started, the more people who are aware, the better the chances of their registering with us and increasing the base, right? So the first thing that we would like the government to do, and this is something that is in the pipeline, it's not like they're not working on it. We just want it a little faster. There is an awareness campaign that the government can run. I mean, they have better resources than any individual organization, spoken about more frequently. And it should be propagated saying it's a safe procedure. You don't lose anything. On the other hand, you save someone's life. It's not just the patient, it's the patient's family that will, be thankful to you forever. You're doing something that they could not do. Okay, that's number one. Number two, I'm sure Dr. Vanshi will agree with me when we say that to run any organization, we need funds. So when we talk about HLA typing, it costs us money to do that. It costs us money to do a medical checkup for a donor, right? When you talk about a non-government organization or an organization working, outside the government like this, people will always ask you, why do you charge? Why do you fund? Why do you ask for money? Everything moves when there is money. I mean, we can only run a camp when there is money to run that camp. Right. So if the government can help with funding, that will really help push the information out, because every healthy person has the potential to save a life. And with smaller families coming up, the chance of finding a match within your family is only 25%. Which means that if you have 5 siblings, 5 brothers and sisters, one of them might be a match for you. Your parents would be 50% match, because half your DNA comes from your father and half from the mother. Right? So finding a match within the family is 25%. What happens to the next 75% of patients? And we know that cancer is spreading. I mean, 10 years ago, 5 years ago, we knew someone who had cancer in our, people we know. Today, it's close family that we know someone has got cancer. So the more people who register, the higher the chance of a patient finding a match. And finding a match for an unrelated donor is 1:10,000 to 1:1,000,000. And the last thing I would like to share for this particular question, Dr. Sangeeta mentioned that we're about 1.36 crores in India. Datri has a registered base of little less than 5 lakhs, 4.7 lakhs. We're not even 1% of the population. So you can imagine that the quantum of people we can register. So we would like the government to help in awareness creation, and we would like to ask the government for some sort of funding to ensure that this does not stop because of paucity of funds.
Dr. Sangeeta, let me come to you, and this is the last question. And I want, after Dr. Sangeeta, everybody else also to share their closing remarks on this. What are some of the common myths that are associated with blood donations, in your opinion?
One, I already said that it leads to weakness, one should not donate, or हड्डी कमजोर हो जाएगी, खून पतला हो जाएगा और हम नहीं देंगे. And I've seen, I am associated in a hospital, so I've seen the with our kind of mindset, even if we are a big obstetric hospital, we have around 15,000 deliveries per year. So even if the woman is bleeding and is having PPH and she is dying of that bleed, so the family members of the boy will say, please don't donate for her. So that is one of a big hurdle. So blood donation is, I would like to say that blood donation is a very, very safe process. So the small adverse donor reactions here and there, they don't make it unsafe. Anything like crossing a road is also hazardous procedure. So like, but in totality, blood donation in a safe place is a very safe practice. Everybody should come forward for blood donation. It does not lead to any health hazards. It does not lead to weaknesses of any kind, not of the physical weaknesses or sexual weaknesses, or my heart will become weak or my bones will become weak. People say all kinds of things when we counsel them to come forward for blood donation. What we are focusing is that the number of relatives who are accompanying the patient, we want to turn them and we want to change them into repeat regular voluntary donors. We tell them, see, your patient is in this position now, so tomorrow somebody or anybody might be in this position, so please come forward regularly and keep on coming frequently after every 3 months for blood donation. So that is our agenda in motivating the blood donation.
Dr. Vanshi, would you want to add something to this?
Main things which I see, they are not free to donate. They don't have the time to come here and donate. Secondly, जब जरूरत पड़ेगी तब दे देंगे, क्यों अभी दें, हमें तो जरूरत नहीं है. Secondly, थोड़ा दर्द होगा, they are anxious about the procedure. The needles are disposable or not, whether we are getting the infection through your procedure, what type of things you are using. So all these myths are there, which we explain to the in the camps, even in the corporates, which I have seen. They'll ask a lot of questions pre-camp. So after solving their queries, they come forward to donate. So you have to connect with them, to the donor, to explain everything in advance.
What are some of the common myths associated to blood stem cells that you've come across?
Everything you've heard about blood donation is a ditto. Okay, added to which I'm giving my blood stem cell. So I'm giving it to a cancer patient. I match to a cancer patient. Does that mean I'll get cancer later? Okay. Also, like Dr. Vanshi said, people are not free to donate. Okay, she talks about time. I talk about influencers. People who have influence in your life. Your parents, your spouse, your friend circle, who will tell you why do you want to do it? What do you gain? Okay. Incomplete information is a huge hurdle for us. I don't know enough, so it is better to say no than to say yes and move ahead. Okay. This also comes from a point where your traditional family physician may not understand blood stem cell donation. Is not, an oncologist who's dealing with cancer patients, is not related to the blood bank, does not understand apheresis very much. So we'll tend to go with the safer option of saying, kya zarurat hai? Okay. And I think one of the hurdles we also face is the fact that we cannot disclose patient details. For 1 year, there is total confidentiality. Okay, so you actually don't know, you only know that you're donating to a child who has this disease, and maybe you know male or female. But if you don't know who you're helping, a lot of people have a question mark then in their head saying, am I doing the right thing? So those are some myths that we work with. And like Dr. Vanshi said, that there's a lot of counseling that happens. So we counsel the donor, the spouse, the parents, the in-laws, the neighbors, everybody who has an influence in your life. Because like I said, every donor is capable of gifting life. So we can't leave it just because you had too many questions.
Dr. Sangeeta, I have one question, one last question. I know all of you are busy. Specifically to you, because of the institution that you are associated with, and like you said, you had 15,000 surgeries or deliveries that happened in a year. And you also mentioned that, sometimes the boy's family says, "Ye nahi karna." What are the such kind of situations that you come across, which is so unique to India, where there is a hindrance that you face to motivate or inspire people to donate blood for, whether it's a girl or a girl child or whatever? I don't know. I mean, this is a sad situation for this country, but what are such kind of situations that you encounter in your profession?
One, I said that the boy's family would say, don't donate for her. And we've also seen episodes where the boy's family would leave the woman entirely if she has had a girl child. So those are very common occurrences, particularly in the lower socioeconomic classes. We are dealing with those kinds of patients primarily. So what Dr. Vanshri and Ms. Sumati has already mentioned, that counseling and IEC, information, education and communication goes a long way. Once we talk to them one-to-one, they really understand that this is important and this should not be done. So there are several problems. In our pediatric settings, we have small kids who have aplastic anemias. So in aplastic anemia, the bone marrow does not produce any cells, let it be red cells, white cells or platelets. So they are undergoing the treatment for that. So stem cells is the answer for aplastic anemia, but what Ms. Sumati said, we are not getting enough donors, and most of these patients can't even afford stem cell transplants. So they are being managed by the alternative medical treatments. In that process, they need lots of transfusions, red cells and platelet transfusions. So we at our end are trying to motivate donors. We have associated with many, for platelet pheresis, for other blood donations, we try to hold voluntary blood donation camps. For platelet pheresis, we have our own voluntary blood donors registry. We call the people and we tell them that this particular child needs platelets and he'll be needing platelets for at least 1 month till ATG is being started, because that drug leads to reduction in platelet count at that particular time. So we have lots of small kids with malignancies, leukemias, aplastic anemias, thalassemia. We have a huge load of children with thalassemias who, they cannot produce right kind of red cells, so they need bi-monthly red cell transfusions. So we have around 500 plus or so registered thalassemia children with us. So there we have lots of problems, but we are moving forward, we are inching forward, and I'm very sure, and with our increase in voluntary blood donors base, we'll be able to solve most of the problems.
It's heart-wrenching to see that this is just one institution in one city of our country, and so we can all imagine the kind of need that is there for people to step forward and take charge and contribute in a way that does not cost them anything. So I think, it is such a beautiful conversation that we've had today on the importance of blood donation and breaking the myths and coming ahead and making a healthier, safer society that we can all live in. I want to personally thank all of you, Dr. Sangeeta, Silvani, Dr. Vanshri for taking our time, Ms. Sumati Mishra. I know you all are very, very busy. But this conversation can actually contribute to a more educated society. So thank you so much for taking our time. I really appreciate your joining us today.